Dr. Max Hamburger was 13 when his father got rheumatoid arthritis.
I think the main thing that he couldn't do was that he couldn't toss me a ball, couldn't catch a ball, couldn't go bowling with me. I watched him be very brave for a very long period of time. I also watched him suffer, and I watched him die way too early.
Today, Hamburger is a rheumatologist in Long Island, New York, always trying to find better ways to understand and treat the disease that afflicted his father.
We take it for granted that when we go to move without impediment. We take it for granted that there is no resistance to the bend of our hinge joints, and so when we got to get up and go, we get up and go.
For the first time, Dr. Hamburger is about to get a feel for what it was like to be in his dad's shoes, being outfitted with a special suit designed to replicate the sensations of having rheumatoid arthritis, a joint disease that affects about 1.5 million Americans. So you've got the entire suit on now, Dr. Hamburger. How do you feel?
Very uncomfortable. I mean, every muscle in my arms and legs is not happy right now, because of the position that my joints are being forced into.
Velcro bindings and laces restrict the joints. Boots simulate the stiffening of the upper and lower ankles and the deformities of the forefoot. A collar demonstrates the impact of RA on the spine.
My stride is about a third of what it should be, and when I try to get my stride going, I can't do it. I can't let my arms move the way they normally do. I don't usually walk around stuck like this, so it's incredibly limiting.
It is a humbling experience for a doctor used to an active lifestyle.
You used to be able to move your wrist and your hand, and I can't do that.
Of course, no simulation can fully replicate the pain that people with rheumatoid arthritis suffer, but it may bring awareness and understanding of the disease to a new level.
I declined, I regressed, yes, pain. Terrible pain, I remember.
Bess Schear, who has battled RA since she was 24, says in those early days of her diagnosis, she could have used a doctor who understood her symptoms better.
It can't actually ever tell a doctor specifically what it's like to live with a disease such as RA, but it can increase their empathy.
This is the RA suit. It's supposed to make you feel like you're a patient.
And empathy goes a long way when it comes to good patient care.
Only with great difficulty.
Dr. Hamburger says wearing the suit may add weight to short-term pain management for his patients.
It's going to change my perspective on everything I do. This is tiring.
With Everyday Health, I'm Stephanie Tsai.